Yeah.
Ride your truck, right? So, yeah.
Oh, we're going to export between.
You went towards your house, and I was coming out of there.
Captain Caveman, you're gonna call this thing to order? Yeah. You're gonna call this thing?
Yeah, I will.
Captain Caveman.
Is this gonna be it?
Yeah,
Everybody on Zoom.
yeah, Arlen isn't here.
Arlen's not here.
Neither
Liram, I
is,
knew
uh,
Liram was
Liram's
not gonna
not
be
coming.
here.
wasn't coming.
All right.
Bob's here.
What's that?
Bob is here. You have four.
Okay. Where's he at? What's he doing in there?
Hiding in his office.
Hiding in his office. Holy cow. He's board chairman. What do you do with him? Nicholson in there? You okay?
Be facetious, I'm sorry.
All right, we'll call the budget hearing to order. And Becky, would you call the roll, please?
Jim Sheeline,
Here.
Doug Barster,
Here.
Tom Kitson,
Present.
Rick Humphrey.
Here. All right. We have the Lee County Finance Social Services part and of the budget hearing. And the first one up is Lee County Council on Aging. Who's got Council of Aging? Susan, I see you're listed up there, but you don't have your camera on and I don't hear you.
Microphone's muted.
Do we still have Susan? All right, we can come back. Hopefully Susan will rejoin us. So let's move on. Next on the list is Lifescape Community Care Program. Who has that?
You did also.
I'm sorry, I'm here now.
Yep. All right, sounds good.
One of these days, I'm going to figure all this out. You know, I don't know. That day's not today.
That's true for all of us, by the way.
Yeah, yeah. I didn't think I was old until I had to use technology every day. My name is Mike Hughes. I'm the executive director of Lifescape Community Services. We actually have two submissions that we do every year. One of them is our we call it a nutrition program, or home delivered meals, or Meals on Wheels program. That's one that we've been doing with Lee County for years and years and years, and we've appreciated all of that Lee County does for us on that for so many years. The other one is our community care, our adult protective services program. We picked up that program from Lutheran Social Services in 2016. So you've been funding us with that since 2016. My submission is, what we put in there is pretty self-explanatory, but let me just give you a bit of background on some of those programs. So we, again, for Lee County, we are both the adult protective services, community care program, and the nutrition provider, Meals on Wheels for seniors there. What's nice about the way, and we also just recently picked up the retired senior volunteer program for Lee County as well. So we recently became the designee for RSVP program in Lee County as well. So we're growing our presence in Lee County every year, which I really appreciate. I think that's important for us. What's nice about what we do with these things now is, for instance, we have drivers in all of the neighborhoods visiting all of the seniors that need our programs in Lee County, and there's a smooth transition now where that wasn't before, from people who need further services from us, because we are the ones providing those services. There are many examples that we have of in the past where we had a Meals on Wheels driver go to a senior's house, notice something that needed to be done, and we'd have to refer that to the organization that did these services, whether it be the care coordination unit or the adult protective services unit. Now it's a seamless transition, and the directors that oversee those meet every week, and we're able to have a full service on those clients. So I'm really excited about that. That's really working well, and it really worked well during the pandemic. As you know, and everybody will tell you here, our clients, the seniors that we took care of, were the most isolated during this time. And I can see everybody's heads nodding because it's true. You know, our clients needed the most help, and everybody here, I know, did everything that they could to take care of these clients. You know, I know a lot of these folks on the call here. I know what they do for people, and they do just great work. So, you know, for us showing up with a meal or us showing up, you know, to take care of somebody who's maybe been abused, and actually being at their door with all proper precautions was a big deal for our clients. We heard that many times over. Normal times for our home delivered meals, we're one of the only people they see during the day anyway. We do a welfare check on our clients, but during the pandemic, and believe it or not, for a lot of our clients, the pandemic is still real. We're all still on Zoom. We're still doing all of these things. It's even more so. So, but I think that the integration of these programs that we're doing, that we're strategically doing that, whether it's a volunteer for maybe a more active senior for RSVP, or maybe a senior that needs some help that might be getting financially or physically abused, or someone that just needs a meal, that's been really working well and efficient for our clients. So I'm really excited that that's working, and it's just providing a higher level of care. We have
Oh. Is that frozen on our side? Oh, it's on his end. Yeah, Mike, if you can hear us, you froze on your end.
Go ahead and, are we gonna talk about these individually, or we gonna at the end, or?
I think at the end. Yeah, this is the way we've typically done it.
We'll see if Rock River is available.
Okay, Mike has dropped off. Okay, so that's Mike.
Council of Aging, she's still up there, or no?
Did what?
Susan, yeah.
Susan's not.
Mike isn't.
All right, going down, next on the list is Rock River Valley Hospice.
Hi, my name is Emily Taylor. I'm the executive director here at Rock River Hospice and Home. As Mike was attempting, I think, to let us know, and I think we all know, it's kind of echoing everything, is COVID has obviously been a challenging year in the healthcare world. I see my fellow Serenity folks on there, and I know they have met the challenges as well in providing care during a pandemic. And so some of the challenges that we faced as an organization, as many healthcare providers did, is making sure that we had all the PPE in place, making sure that those that were being served in the community were feeling comfortable having someone come into their home who had maybe just been in another home. So that was often a barrier to make sure that staff felt comfortable, as well as the patients and families felt comfortable. We were an organization that did have COVID positive patients here on site, and as well as serving them in their homes. So that posed some interesting challenges as well, and making sure that things were segregated in the way they needed to be to keep the rest of the individuals safe, as well as meeting the needs of the emotional side for folks. That was a huge issue for us, and making sure that people could see their loved ones at the end of life. And so fortunately, there were some provisions that were allowed that we could still have some visitors with COVID. That was a little bit of a challenge if they were COVID positive, but still we got creative and we had to figure that out, as many people did, to meet that need. And so I'm proud of the staff that rose to that, and the rest of us in that world that met that challenge. So we did obviously see some more complex grief over this last year, and oftentimes that grief really was the issue of not so much that they maybe didn't see their loved one in the very final moment, but maybe they had been hospitalized for a week or two prior and they were not allowed in the hospital. So you're having to grieve in a different way. So that has been a challenge, and we provide support through this funding for our emotional support type of programs like the bereavement program. So I thank you for your consideration again this year. We've greatly appreciated all that you do for us, and I will not belabor it. Thank you.
Thank you very much. And we appreciate everything that you guys do.
Thank you.
Yeah, sure, go ahead.
I'm back. I'm sorry. If you have any questions, I didn't want to interrupt anybody. I'm sorry I lost you. I'm very, very sorry.
No, that's okay.
On Rock River Hospice, so you were impacted financially considerably through the COVID, is that correct?
We did receive some of the federal funding that was available. So yes, we were impacted, I would say, but we were able to sustain. So we're appreciative of that. We did have an increase in those that we served because of the pandemic. Our inpatient unit, many a days we're running full and with a waiting list because we were a unit that would take COVID positive patients. So there was a great need and continues to be.
Thank you.
Next on the list is Catholic Charities. Julie?
Good evening. My name's Kathy Waitman Moore. I'm going to start and then Julie's going to chime in. I have Catholic Charities provides the long-term care ombudsman program, advocacy for individuals living in long-term care facilities. And until January, I served as the regional ombudsman. And in January, Julie went to that position when I became the director of Catholic Charities. So we've kind of shared the year in terms of COVID and the challenges that we've faced in serving the residents of long-term care. And our role is to be advocates for individuals who live in long-term care. And those residents have been greatly impacted by COVID, as we all know, in advocating for residents to not only receive good care, but maintain as much independence as possible, work with them through the discharge planning process so that that if whenever possible, they're able to return home. Because of COVID, a lot of challenges ensued in terms of us being able to physically access and go inside buildings. So we've had to be creative in terms of how we do that. So I'm going to let Julie now talk about how an ombudsman had to pivot in order to continue to maintain contact until we were actually allowed back inside. And I say allowed because the ombudsman program is a federal program. It had to come from the federal oversight to say ombudsmen are required. You're required to allow ombudsmen in the buildings. And we know what an impact COVID has had for those residents. So Julie, you want to talk about?
Absolutely. So thank you, everyone, for having us tonight. So as Kathy was saying, just to continue with that, our focus has always been the residents while we were doing visits during COVID, whether that was window visits, virtual visits, or visiting residents with the proper safety and PPE inside the facilities. We have always wanted them to understand that we are still there to advocate for them, still provide the service, and assist them with the discharge back into the community as needed. And part of that is the care plan processes that the the facility and the residents go through when it comes to making a discharge plan for the resident to reintegrate back out into the community. So to support that during COVID, we actually had an outreach project that went out to every facility and every resident inside the facilities to support this. So I'm just gonna do a quick show and tell. We had an activity bag that looked like this that was given to all the residents. And inside of it were many things to help them through the isolation, but included in that was a care plan brochure to support their want to go home and to discharge back out, or whatever their goals were while they were in long-term care, along with an activity book that also talked about person-centered care and gave them some activities to do while they were in the facility and going through the social isolation that we've heard so much about. So that was one of our major things. We are now back in the buildings in regular strides and making those personal connections with the residents. But this project really helped bridge that piece until we were back in the facilities on a regular basis as well. So, thank you.
Very good. Thank you. Appreciate it. Okay, next on the list is Meals on Wheels of Dixon.
Hi, I'm Linda Setchell from ASB, and I work with Meals on Wheels of Dixon. I'm on the board, and we again are staff assistant. Our meals, about 1,100 meals in a month, and we run about $1,200 deficit every month. We make that up with different donations from people in the community. Well, we've got some money from United Way. They snubbed the COVID money, and that helped us to keep up with expenses. So we're just asking if we continue with our same ask. Any questions?
Anybody have any questions?
Linda, did you guys lose money last year because of COVID? I know you say you have a $1,200 a month, but did COVID impact that any worse than normal?
No, I don't think it impacted it any worse. It's an all volunteer run. And so, of course we had a little bit of difficulty getting volunteers to go and deliver. They didn't want to go in the houses. Completely understand that. So we made other provisions. I had some of my staff deliver so that we got the meals to everybody. Nobody ever went without. And it was really important, as we've heard, for the socialization, to check in, make sure people were okay. We found a couple of people that were sick and got them assistance. So took care of them, and they, I believe, got back home. So anyway, we did have a small impact. I'm going to tell you, we lost any more money. We did have to raise the price of the meals that we delivered to patients or to the participants. Not drastically, it just went up 50 cents a meal. But when you break it out, somebody's on a fixed income, it can be quite a bit. And our participation has increased due to the COVID season, and they're still on the program.
The cost increase just due to the cost of
food.
Okay.
Cost of food.
Okay.
Yeah,
Thank
we
you.
don't charge for any labor. We don't do any of that.
Right.
It's just covering the expenses.
All right. Thank you.
Thank you very much. City of Amboy, Meet and Eat. Who is here to represent that? Don't have anybody for Amboy Meet and Eat. Righty. Okay, the next one is Serenity Hospice.
Hi, I'm Lynn Canotto, and I'm the CEO of Serenity Hospice and Home. First, I just want to thank all of you for the opportunity to present our programs and our needs as the board determines allocations for this grant cycle. And coming out of such a difficult year, no doubt the need is very high for many nonprofits, so we really appreciate the opportunity. Like all organizations, 2020 was a really challenging year for Serenity. With the lack of adequate personal protective equipment, the risk of caring for patients in their homes took a toll, as many on our staff, as many were afflicted with COVID throughout the year. Providing the best in care with reduced staff became our mission, and we were proud that our patient satisfaction scores never wavered during this difficult time, with all categories remaining above national benchmarks, and Serenity again being awarded national elite honors for this achievement. Once PPE became readily available, remaining safe while providing care was still a challenge. Although our staff was trained a number of times throughout the year on how to properly put on and take off PPE, they were still getting sick. Where most clinicians work inside a facility where special areas can be set aside to properly don and doff PPE, our staff had to stand on porches many times during the wind and snow to perform this task before entering a home or when leaving. It was often difficult for them to maintain proper barriers with nowhere to wash their hands. Oftentimes, we would learn after a nurse or an aide had been to a resident many times that several family members had tested positive for the virus, and our clinician would become ill. As with many organizations, some of our services went virtual. Nursing homes restricted access, so patient visits were done through windows or telehealth. At a time when grief was at a high point because many people could not be with their loved ones during their last days and could not have proper funerals, Serenity took many of its bereavement groups online in an effort to keep those in need of services and staff as safe as possible. In-person bereavement visits with masking and social distancing were still available, and the bereavement center remained open. However, many were fearful of in-person contact. Planned children's camps and school counseling sessions were put on hold. Personal phone calls to all families still continued, as did normal bereavement mailings that occur the 13 months after the death of a loved one. As the virus began to wane, in-person groups with smaller numbers, masking, and social distancing did resume. Serenity also continues to provide resources on how to reduce COVID anxiety. Many were finally feeling like the pandemic was starting to decrease due to lessening positivity numbers, only to now see those numbers on the rise once again. While vaccines are making many feel safer, there is still a large percentage of the population that are fearful of getting the vaccine and also fearful of getting COVID. As 2021 continues to unfold, Serenity is hopeful that we can keep our bereavement groups in person and not have to return to virtual. Our bereavement center serves our community in many ways, and like all bereavement groups and services are open to all who have suffered a loss, regardless of whether or not we've cared for that loved one in our hospice. Serenity's bereavement services are a requirement of our licensing, but they are not funded by Medicare, Medicaid, or private insurance. Most of the fundraisers we had planned for 2020 and 2021, which support all of our programs, have had to be canceled. All this happened at a time when our census grew from serving approximately 50 patients per day to up to 99 patients a day, many of them with COVID. The effects on mental health from COVID-19 are just now starting to be understood. From those suffering long haul effects long after recovering from the virus, to those who have stress and anxiety due to the loss of the life they once lived. Adding the death of a loved one to the individual dealing with a myriad of stressors brought on by the pandemic makes Serenity's bereavement programs an even higher necessity in the months and years to come. Lastly, another challenge in these times is the unprecedented turnover of clinicians in the healthcare industry. Many are suffering from burnout and are experiencing other mental health issues. Opportunities are boundless with increased salaries and benefits offered in all areas of healthcare. Serenity's reputation has allowed our organization to continue to locate and hire the best, but turnover costs are expensive as we continue to find ways to support our staff so they can continue to provide the best in care to those in need. Overall, as everyone, it's just been an extremely challenging year, and it continues to be a challenge, but we are honored to be able to care for those at such a difficult time.
Thank you for being with us tonight, Lynn, and appreciate your presentation and what you do.
Thank you.
Last presentation tonight is the Village of Paw Paw. Do we have a representative from Paw Paw? Hearing none.
Susan's on my phone now.
I was just gonna see if Susan had figured something out. So, Susan, can we hear you? Susan? I don't see a mute. Oh, is it still there? No.
Well,
Okay. Well, you have in front of you what their ask for this year is. So,
wait for Mr. Forrester to get back here and
right, and we'll have our discussion.
Don't we usually do discussion
You don't
after
have to.
everybody's gone?
You can if you want. You're more than welcome to stick around, but you don't have to. We can let you know.
So we should, came up with.
Well, it's a public meeting.
Okay.
well, I guess, I mean, where I'm at is, I mean, these are all services that definitely are needed and used and stuff, and we've helped them out in the past. I guess Doug brought up there a little earlier that there's a possibility we could look at some other funding avenues if they qualify through the American Rescue Plan or whatever that acronym is.
So,
I
Board
get,
Chairman, Mr. Olson would like to speak.
Well, that's what I wanted to talk about too, and you know, you alluded to it. We got more funds available, so I mean, and that Meals on Wheels, I think would check all the boxes. I'd have to get it verified, but I don't know about, you know, I don't think this hospice and other stuff would be able to check the box, but you got more money available if you want to use it there.
well, I guess where I was going with this is that the request is $9,000 increase collectively with all the different requests here. I believe in our budget packet that Paula put together for us, she put in 100,000. So that's actually $1,000 less than what was given last year. Our current budget situation is pretty tight. I don't have a problem staying at last year's level. And if we find that these funds are eligible, meeting these requests and possibly even being able to hand out some more to whoever, if we so.
So Bob, if we wanted them, now would, the way that ARP money works, would these groups apply directly to the ARP committee?
No, no.
Or we would,
give them the money, but we need to make sure it's dispensed properly because we're still liable for how it's dispensed or how it's spent. And so we need help with reports to report back for our report, back up our grant.
so like every single one of the presentations have mentioned how they've been impacted by COVID. And so that would, if they were able to document, you know, those effects and that would help the committee in
Real careful
awarding
saying
those
they'll all-
funds.
They'll all fit the box because it's to mitigate risk too. It's the main thing with this grant we have. So Meals on Wheels is perfect because we're keeping them out of the public. They want to be served at home. So I don't know if you just want to decide tonight, like Rick said, and then if we got some more, we're gonna have a meeting August 12th. Maybe we come back and
Well, and I guess that's a question that I got. I mean, can we go ahead and approve the funding, the funds as at the level they were in 2021? We've already kind of got that budgeted. If we find that some of these check the boxes, we can increase to the request levels and possibly even do a little bit more if so.
So I think a cleaner way would be to table this and then wait till we make sure at your next finance meeting. I think they can all go home tonight knowing that they're going to be funded at last year's level anyhow. And there might possibly be some more.
Yeah, I mean, I guess that's what I was trying to get to. Approve last year's level and possibly more.
Yeah, rather than make a motion and vote on it, then we're gonna have to reopen it. And I don't know how the correct way to do that is. So your chair would know.
Well, I would say table, well, we're in a hearing, so we're not making any decisions tonight anyway. So there's no motion on the floor but we can, you know, the folks that have presented, if they can
say at the end of tonight, somebody made a motion to approve. We made a list and we approved it. So everybody knew when they're going home tonight, that they know.
Last year, we made a motion that we would fund at that level. So I would make the motion that we fund all these organizations at the level we did last year with the
Caveat.
stipulation caveat that we would up them if we can through that CARES program or that.
The ARP
money. The ARP money. I'm sorry, Nikki. I'm sorry. I would make the motion that we fund all these organizations at the level we did last year with the caveat that if we can get the money funding through the ARP funding, we would improve all those to their request level.
So we have a motion on the floor. Is there a second to the motion?
I'll second that.
Humphrey seconds. Kitson makes the motion. Humphrey seconds. All those in favor, what were you going to say, Beck?
Susan Lawler's on her way up the elevator, so I didn't know if you wanted to wait until she presented.
I think
She's on her way here.
In the elevator.
Well,
Yeah, we'd love to hear.
I just wanted to make sure you
she
knew.
can still talk. but I think-
Yeah, she can still talk. We have a motion on the floor, however. No, you're fine. Come on in. So. We're going, Susan, where are you? Hello?
Microphone over there at the podium if you want to go there. Yeah.
Yeah. So we've already got a motion on the floor, but we're more than willing and.
Oh,
we're all
I'm so
okay.
sorry.
No, you're fine. It's all good.
Appreciate your resubmitting.
So
I ran
all-
just as
all
fast
those-
as I could.
All those in favor of the motion signify by saying aye.
Aye.
All opposed, motion carried. Susan, you have the floor.
Thank you very much. I appreciate it. I am terribly sorry.
Should we give
But
her
I
just a
do
quick
want you to
nod?
know that everybody here, I heard, and they've all been suffering from COVID just as much as we have. I have a staff of 4 people and myself. That includes cleaning people. And I have 3 drivers. So this year, we serviced over 13,000 people, even with COVID. 8,906 people were our riders, and we did that with 3 drivers. We do partner with lots, and we take on any of theirs, but our seniors were 8,906, which is about 57 rides per driver each week. So they are very, very busy. I'm so proud of my staff because we stayed open through this whole COVID. We are only one other senior center in the state of Illinois stayed open, and we are the other one. And I think that Lee County should be really proud that we were able to take on this responsibility. Not only that, we took on the responsibility of Whiteside and Ogle County because they closed down, and they are still closed down until October, and we are still seeing their seniors. And we feel that, we've done so much, and we know there's so much more we need to do. But our seniors have just rallied around us. And we've had the greatest amount of seniors that have participated in phone calls, face-to-face appointments, and membership is the highest we've ever had in the history of Lee County Council on Aging. So go figure. People have been sending their $20 in just to keep us going. And I'm just so thrilled that we would have people that cared that much about us. We partnered with Lifescape this year, and we did 100 box lunches where we delivered 90% of those because not all of them could come to the center. We partnered with United Way. We do lunches with United Way for the Summer Eats program. We have our own lunch program, which we are running out of funds, so we're only doing it once a month instead of once a week. We have 37 isolated seniors that never get out. So we have taken that upon our responsibility here to go see them. We do about 900 phone calls in between my staff and myself every 2 weeks to talk to our seniors just to see where they're going and what they're doing. We'll see over 800 again this year in Part D. Last year, we did 50% face-to-face and 50% on the phone with them. Some of them we did Zoom when it works. It's great. And, and we had an outside library that we've kept going, which has been free while the library was closed. We had a library going. We put in a garden so the seniors could sit and drink coffee in the morning. And we also, I don't know if you noticed, but we published 2 books this year, and it's all the writings of the seniors. So we really are thrilled what's going on. Even though it's COVID, we are finding so much love from our seniors that I don't know if you can ask for anything more. Thank you so much for letting me come. I'm so sorry again.
It's happened to all of us, Susan. So just so you know, the motion that was on the floor and that was passed by the committee is that we are funding everybody at the level that they requested last year. And if there is the ability to get more funding through the ARP money, the American Recovery Program money that the county received from federal government, then everybody will be funded at the request levels. So if everybody that's still on, if there is further information that we need to shore up, making sure that you guys fit the box or whatnot, we'll be in touch and for any request of information. Yes,
Just a quick point. We're gonna fund them at the amount we funded last year.
Isn't that what I said?
You said what they requested last year.
No. Well,
That's what you said. So we'll
yes,
fund them
at the
what we
level,
gave them
yes,
last year.
yes, that's right. Sorry.
Just clarify.
So what you received last year, that's what the motion was, to approve the level of what you received last year. And then if we're able to do up to your request through the ARP money, then we'll do so. Okay? Absolutely. Mr. Chairman.
So the mayor of Amboy was trying to get online. They wouldn't let him in either. And he wanted to know if we had any questions for him. We're supposed to call him. We did. Also, when we talk about that Meals on Wheels at the ARP meeting, August 12th, maybe we can go above some of these requests because they didn't realize we had them funds available. So I hate to put that carrot out there and not follow through, but we do have some leeway there. So maybe we'll discuss that then.
Very good. Yes, Mr. Forrester.
And I would like to also say, and not only that, but with the fuel costs up over $1 more a gallon than it was this time last year, obviously you're going to see a big increase. I know you said you were running a deficit, ma'am, about 1,200 a month. Is that correct? Well, you figure whatever more it'll be this year. Obviously the cost, you get the same amount of clients or more, it's even going to be more expensive, probably to the tune of about 40% more.
Yep. Very good.
We might have to, one more thing, we might have to send out a questionnaire to these and then have them answered to us so we know that we're checking all our boxes, I guess.
Yep.
Just to add a little bit to that, we will definitely be sending out a questionnaire under ARPA. And because we have reporting to do, the federal government wants reporting on the ways that we spend this money. We are going to need feedback from these entities that would be eligible for and receive some of that ARPA money. So we're going to set up a bit of a structured program that would include that reporting back, but also the check boxes, so to speak, to make sure that they meet it. But I think there's a very real possibility that these entities would definitely meet it. So we just got to get the structure in place.
That'd be great. Be better than the federal government in that regard. Any other comments from the committee? Any other comments from our folks on Zoom? Hearing none, I'll entertain a motion to adjourn. Moved by Kitson, second by Forrester. All those in favor signify by saying aye.
Aye.
Have a good evening, everyone. Thank you all for coming.